Thank you very much, and I'll turn it back to you, Dominic.
Thanks, Patty. And I should have mentioned Dr. Berthiaume is also joining us and will be available to answer questions. But now we'll turn it over to Dr. Tam and Dr. Njoo. Dr. Tam.
Thank you. Bonjour à toutes et à tous. And this week, as vaccine delivery begins to ramp up at an accelerated pace, there are hopeful signs for better days ahead. However, increasing case counts, a rising proportion of new variant cases, and shifting severity trends are cause for continued caution. To date, over 938,000 cases of COVID-19, including over 22,700 deaths, have been reported across Canada. Over the past week, there has been a further 15% increase in daily cases, with an average of over 3,600 new cases daily. Increased infection rates are starting to impact severe outcome trends, including hospitalizations and deaths. Over the past 2 weeks, these lagging indicators of COVID-19 severity have leveled or increased. On average, over the past week, 31 deaths were reported daily, and over 2,100 people with COVID-19 are being treated in our hospitals each day, including over 580 in critical care. To date, close to 5,500 variants of concern cases have been reported across Canada, with a B.1.1.7 variant accounting for over 90% of these to date. As the number of new variant cases continue to increase, they account for a greater proportion of COVID-19 cases across Canada, reminding us of how tight the vaccines versus variants race continues to be. Though we're all tired of the tricks and turns of this virus, we have progressed and met each challenge along the way, and we'll be better and stronger for it. With spring here and vaccines rolling out, we've got more daylight hours and much cause for optimism for the warmer days ahead. The vaccines that we prioritize to protect high-risk populations and those who help keep our pandemic response, society, and economy running are beginning to show benefits. Prioritizing seniors and long-term care, followed by those in the community, has contributed to much reduced infection rates among seniors. Just as they have paved the way for the life we have in Canada through hard work and sacrifice, seniors are once again showing us their leadership and determination by rolling up their sleeves for COVID-19 vaccines. Though it may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated. Many may have already helped a parent or grandparent book their vaccination appointments. You now have experience in navigating your local vaccination rollout system, so there may be others that you can reach out to. Working online, over the phone, or in other ways, you can help others. Like so many areas of health, no one is protected until we are all protected. Be a vaccination champion by providing credible information on COVID-19 vaccines or practical assistance to help others. And as we look with increasing optimism towards our future, following public health advice and maintaining individual protective practices remains important for keeping us all safer and clearing the runway for vaccines to do their part. Thank you.
Bonjour à toutes et à tous.
Good day, everyone. This week, as vaccine delivery begins to ramp up at an accelerated pace, there are hopeful signs for better days ahead. However, increasing case counts, a rising proportion of new variant cases, and shifting severity trends are cause for continued caution. To date, over 938,000 cases of COVID-19, including over 22,700 deaths, have been reported across Canada. Over the past week, there's been a further 15% increase in daily cases, with an average of over 3,600 new cases daily. Increased infection rates are starting to impact severe outcome trends, including hospitalizations and deaths. Over the past 2 weeks, these lagging indicators of COVID-19 severity have leveled or increased. On average, over the past week, 31 deaths were reported daily, and over 2,100 people with COVID-19 being treated in our hospitals each day. This includes over 580 in critical care. To date, close to 5,500 variants of concern cases have been reported across Canada, B.1.1.7 variant accounting for over 90% of these to date. As the number of new cases, variant cases specifically, continue to increase, they account for a greater proportion of COVID-19 cases across Canada, reminding us of how tight the vaccines versus variants race continues to be. Though we are all tired of the tricks and turns of this virus, we have progressed and met each challenge along the way, and we are better and stronger for it. With spring here and vaccines rolling out, we've got more daylight hours and much cause for optimism for the warmer days ahead. The vaccines that we prioritize to protect high-risk populations and those who help keep our pandemic response, society, and economy running are beginning to show benefits. Prioritizing seniors in long-term care, followed by those in the community. This has contributed to much reduced infection rates among seniors. Just as they have paved the way for the life we have in Canada through hard work and sacrifice, seniors are once again showing us their leadership and determination by rolling up their sleeves for COVID-19 vaccines. Though it may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated. Many may have already helped a parent or grandparent book their vaccination appointment. You now have experience in navigating your local vaccination rollout system, so there may be others that you can reach out to, working online, over the phone, or in other ways you can help others. Like so many areas of health, no one is protected until we are all protected. Be a vaccination champion by providing credible information on COVID-19 vaccines or practical assistance to help others. As we look with increasing optimism towards our future, following public health advice and maintaining individual protective practices remains important for keeping us all safer and clearing the runway for vaccines to do their part. Thank you.
Thank you very much, doctors. And Corinne, over to you now. We'll all be happy to take questions.
Merci. Nous allons donc commencer la période de questions.
Thank you. We'll start with the question period.
Téléphone. Nous allons prendre donc une question.
All questions are over the phone. One question, one follow-up each.
The question period. Everyone today is on the phones. We will take one question, one follow-up question each. Opérateur, première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question, our first question, Marie Vastel, Le Devoir. À vous la parole. Please go ahead.
Marie Vastel from the Le Devoir.
Oui, bonjour. Je sais pas si
Yes, hello. I'm not sure if the question goes to Dr. Tam or Dr. Sharma or Dr. Berthiaud.
Dr. Sharma, if you want to answer in English, that's fine. Donc, c'est au sujet du vaccin AstraZeneca.
It has to do with the AstraZeneca vaccine. We hear today that the National Institutes of Health in the U.S. said it was concerned about a clinical effect in the U.S., stating
may have included outdated information on efficacy. Et donc, je voulais savoir, est-ce que
So I was wondering whether public health shares these concerns, the concerns of the American authorities as to the AstraZeneca vaccine. And what would you say to people who are increasingly uncomfortable with that AstraZeneca vaccine?
Bonjour, Madame Vestel.
Ms. Vestel, this is Marc Berthiaume from Health Canada. I can start with answering your question. Public Health Canada is aware of the notice issued by the National Institute in the U.S. This has to do with information on the clinical studies that were conducted in the U.S. They were not submitted. Those were not submitted to Health Canada, so we'll get them within 4 to 5 weeks. So this is information the manufacturer has to submit to Health Canada. But what we can say to Canadians is that the vaccine, AstraZeneca vaccine, was approved in Canada on the basis of other clinical tests that was examined in detail by Health Canada, showing the efficacy of the vaccine. Many post-marketing tests have also shown that AstraZeneca is effective against the illness and especially hospitalizations or complications related to COVID-19. So the message is the efficacy and safety of AstraZeneca vaccine has been shown on the basis of data that has already been provided to Health Canada, and the additional information that was collected in the U.S. will be sent to Health Canada over the coming weeks, and if there is a need to readjust, we will do that with Canadians later. The issues referred to in the U.S. have to do with the efficacy data and how to interpret them. There was no concern as to the safety of the vaccine, so it has to do with analyzing percentages. In a global sense, the AstraZeneca vaccine continues to be beneficial for Canadians to prevent COVID-19. Thank you. This is Dr. Njoo. Perhaps I can add a few more words in French. From the public health perspective, we are aware of what the excellent work that our colleagues from Health Canada are doing with their counterparts in the U.S. Of course, we work closely with our colleagues from the various provinces and territories, our counterparts. The National Immunization Committee will also be looking at the data and the evidence to provide the best possible evidence to us in the area of public health, and we will be having discussions. We continue to have discussions on data and on the evidence within our advisory committee. I think Dr. Sharma had something that she wanted to say as well.
No, I'm sure other people have the same question, so I thought I would respond in English as well. So the question is really related to the press conference, the press releases that AstraZeneca has put out regarding their interim analysis and then the response from the National Institutes of Health in the United States. So I think first and foremost, it's important to know that these are press releases. These are ways to communicate interim analysis. And AstraZeneca has said that their press release was regarding data that had an earlier data lock time, which was February 17th, and that's not uncommon. So every other vaccine manufacturer has done the same thing. They put out interim data in the form of a press conference or press release. This has been a little bit unusual in that usually that press release is followed by a number of months before they submit their final data. In this case, AstraZeneca will likely be doing their next analysis, which is a more complete analysis over the next few days. So I think the bottom line is there's some information that's there. It's not the complete data package. Health Canada will look at the complete data package when we get that, and we're expecting to see that in sometime in April, and we'll assess all of that and communicate any of those results. Based on the findings that we've seen, and even if there are some differences in terms of the final data points, really the bottom line is that it doesn't change the recommendations with respect to the AstraZeneca vaccine in Canada at this point in time. So we've done the review, we've provided all the information on the basis of the review, and that hasn't changed. So clinically, in terms of the administration, that does not change. But of course, this is information that we will continue to monitor. At this point in time, we, of course, believe that the benefits of the AstraZeneca vaccine continue to outweigh the risks. And then the other part of the question was really around concerns about how this is interpreted and potential implications on vaccine confidence. And of course, that's something that's of concern to us, right? So we've said this many times before that even the most effective vaccine it only works if people trust it and agree to receive it. And once, it's like any other reputation. Once potentially there's some doubt that creeps into that reputation, it's that much more difficult to gain that back. So I think, the press and the concerns around the AstraZeneca vaccine do not help. But what is really important is that we continue to put out accurate and reliable information. So if there is any change to the safety profile, if there is any significant change to how effective this vaccine is, we will take a look at that information and we will communicate it. Thank you.
Je peux avoir ma follow-up?
Can I have my follow-up? Yes, go ahead. I was just waiting for you to tell me if I could go ahead with my follow-up. So follow-up. Dr. Berthiaume, if I understand correctly, just to be sure here, you will be reviewing the AstraZeneca data, but it is unlikely that the approval will be revoked by Health Canada because it has to do with an efficacy and not a safety issue, if I'm understanding correctly. And my follow-up for one of the 4 doctors here, some provinces had started to end lockdown or release it, but Dr. Tam, you're saying that there's been an increase in 15% of cases of COVID in the last week, so that's a worrying trend, isn't it? So perhaps the provinces have loosened restrictions a little too quickly?
Bonjour, c'est le Dr. Berthiaume.
This is Dr. Berthiaume. I'll take your first question. On the basis of this review, is it possible that Health Canada may not approve AstraZeneca? Well, we haven't seen that data, as Dr. Sharma has said, on the basis of preliminary information that was disclosed in the media. It's more an issue of interpreting the efficacy. Now, for the data from these studies to change the risk-benefit analysis for the vaccine, it would mean that the data would have to be very negative, which does not seem to be the case at this point. Based on the available information, it seems unlikely that there would be a change as to the AstraZeneca vaccine being approved. However, additional information from other clinical testing could provide more information as to its efficacy in subgroups and the profile for adverse events. All of this will be submitted to Health Canada. In the interim, we will be having discussions with AstraZeneca and with our counterparts in the U.S. to see where things stand on the data. But I think it would be, in a way, alarmist to suggest that the results of additional clinical testing in the U.S. could lead to a change in the approval status for this AstraZeneca vaccine here in Canada. Thank you. Hello, this is Dr. Njoo. Now I could start answering your second question. As to the increase in cases over the course of this week and throughout the country and public health issues, clearly in each province and territory, it's important to have a strong monitoring system in place to really closely follow what's happening even at the local level. What we're seeing here at a federal, national level is that, yes, there's been an increase. If the provinces and territories start loosening their restrictions, it has to be done very carefully. And if we note that there is a trend, an increasing trend, or that these serious repercussions are starting to increase as well, clearly the provincial and territorial authorities will have to revise, perhaps change their public health measures. This is a very real issue. We just have these discussions within our Special Advisory Committee about these matters, and this is something that we follow closely. Thank you.
Parfait. Donc, prochaine question. Next
Very well.
Merci. Thank you. Our next question. La prochaine question, Mia Rabson, the Canadian Press. À vous la parole. Please go ahead.
Yeah, I think this question is probably for Dr. Tam. You've talked about sort of the increase, or that the severe illness, the ICU numbers, hospitalizations are starting to creep back up again. But there was some data out of Alberta today suggesting, I believe Dr. Hinshaw said, almost 90% of the cases there in the ICU are people under the age of 65. Are we seeing nationally that there is a higher incidence of severe illness in younger people now, or is it more that there are there's less illness amongst seniors, partly because of the vaccine?
Yes, I think it's a sort of complex picture, but what I will say is that with increased replacement, if you like, of previous virus strains with the new variants, particularly the B117 variant, we know that it can take off fast. So its reproduction number, which is something that we talk about fairly frequently, is higher. So it has faster spread. And right now, the highest rates or highest incidence is in the younger age groups. As soon as you get more numbers of people, you're going to see more cases, I think, of severe outcomes. There's been a much stronger evidence coming out of the United Kingdom and elsewhere to say that this B117 variant does result in more severe illness. And it does it across the age groups. So more severe illness if you get it in the elderly, but also in the younger age group. So if these numbers increase in the younger population, I think we're going to see increases in hospitalizations and ICU visits in these age groups. Whether the vaccine has had an effect, that's an important question. I don't think we can sort of say for certain, but what we've seen is a drop in incidence in the 80-year-olds and older. That's some of the first groups to be vaccinated, particularly in long-term care facilities. So that is a positive sign. But we've just began the vaccine programs. Many community-based older adults, the ones that are not in congregate living, haven't been vaccinated yet. So we need to be really careful. And that it's possible to see an increase in severity in any age group with the new variants.
Thank you. And I think my next question is for Dr. Sharma or Dr. Berthiaume. With regards to AstraZeneca last week, the European Medicines Agency decided to put a warning on the authorization regarding the blood clots, noting that there was no increased risk of getting a blood clot, but that they couldn't rule out or in whether or not it played a role in that one specific kind of blood clot. I'm just wondering if Health Canada is considering adding such a warning to the authorization.
Yeah, so the short answer to that is yes. So we are looking at that. We were observers at that European Medicines Agency subcommittee meeting. We've looked at the data as well, and so we're in the process of making similar changes to the information for Canadians. And of course, as we always would, we will communicate that once that's complete.
Thank you. Merci.
Prochaine question.
Next question. La prochaine question. Catherine Lévesque, La Presse canadienne. Your line is open. À vous la parole.
Catherine Lévesque, La Presse canadienne. Hello. I'd like to get back to something you referred to, Dr. Njoo. I'd like a bit more information about this. You said as to provincial reopening, if the numbers increase and if the spread increases, there might have to be a change to public health measures in the provinces. Do you think that at this point the provinces should revisit these reopening plans? Do you think that with an increase in 15% and given this B117 variant, do you think that we're already in that situation? Okay, thank you for your question. I could maybe say this. I didn't say that the provinces are starting to loosen up restrictions too quickly, but what I am saying is that it is something that needs to be closely followed, closely monitored, because at this point we're seeing an increase in hospitalization rates as well. This is something that's relevant for provinces and territories, but also we have to keep a close eye on epidemiology at the local level. You need to have all possible means to do the contact tracing, to isolate, identify, to make sure that everything is under control. If we continue to see indicators going in the wrong direction, if you will, with an increasing trend, clearly the provinces and territories, and perhaps actually even more so at the local level, there may need to be a change in public health measures. Yes, it is something that we can say is that we're at the first stages in some loosening of restrictions for public health measures in some provinces and territories. But what I can say for public health authorities is that everyone is conscious of this issue, that we want to have a very cautious cadence and see how things evolve, and whether we need to make some changes, then I think the authorities are prepared to do that. Thank you for that. I have a question for Mr. LeBlanc and Ms. Hajdu. The Conservatives today have been asking for a reopening plan to do away with the restrictions in the way that the US and the UK have done within the 20 sitting days in Parliament. Is that something that's on your radar? Would you be prepared to present this type of plan while we are here expecting perhaps a third wave? Answer, Mr. LeBlanc. I could add a few comments, and then Patty may have some things to add as well. The Conservatives have now, for a while, have been trying to ask politicians to encroach in areas that should really be the responsibility of doctors and specialists in this field. The provinces in Canada have the constitutional responsibility for applying health measures. And we've seen from the beginning of the pandemic that provinces have adopted different measures because it's really an area of provincial jurisdiction. And this is why you will often see Dr. Njoo, Dr. Tam referring to following the advice from public health authorities in the local regions, because throughout the country there may be different circumstances that may require various measures. Of course, the federal government has an essential role to play in support of the provinces, which we have done financially significantly from the start of the pandemic, and we will continue to support the provinces and territories financially to make sure that they have everything they need to protect their citizens. We have an essential role at the federal level as a federal government in supporting Canadians, supporting Canadian businesses, so these provincial and territorial authorities can make the necessary decisions to protect the public, knowing at the same time that financial support is in place, and that is the role that we have played from the start of this pandemic. We will continue, of course, to work with the provinces, but for the Conservatives to say that they want politicians in the House of Commons rather than scientists to make these decisions, we think this is a strange approach. This is not the approach that we have taken from the start of the pandemic. Perhaps Minister Hajdu has something to add.
Oui, merci, Dominic.
Thank you, Dominic. I think the Conservatives did not realize that health and economic security is integrated.
The motion today, as my colleague has mentioned, first of all, underscores a lack of confidence in the public health authorities and the scientists that are leading our response across the country, and a lack of understanding about the jurisdictional right and responsibility of provinces and territories to deliver health care and to protect the health of their constituents, namely in their provinces and territories. But I think it also reflects a lack of understanding that you can't have a strong economy if your citizens are worried about getting sick every single time they go out. So it's very important that we continue to have a response here in Canada that is guided by science, that is guided by public health officials, that works to support the security, the economic security of Canadians, as we have over the past many months, but also has a true foundation of science-based measures at its core. Indeed, I think my colleague is right when he says it shouldn't be politicians that determine when, in fact, a community should relax public health measures, but it should be public health and science leaders. Thank you.
Merci. Thank you. Next question. Prochaine question.
Thank you. La prochaine question, our next question. Dominic Charles, Toronto Star. À vous la parole. Your line is open.
Hi, thanks. Dr. Sharma, given what you said about Canada weighing the evidence right now on the blood clot issue for AstraZeneca, can you tell me what your advice is to the health workforce that are looking at vaccines right now? Are you suggesting that maybe they should hold off in administering that vaccine in particular to anyone with heart issues or vascular problems?
So at this point in time, we're not changing any of our recommendations, so that the vaccine would still be indicated for those who did not have any other contraindications, so we're not allergic to any of the components of the vaccine or the vaccine itself. We do make mention of people that potentially have an increased risk of bleeding, but that's with any vaccine because it's an injection. So at this point in time, we would say that for people that are 18 years of age and over, that you would look at, of course, the risks and the benefits, but that AstraZeneca would be the vaccine would be an appropriate choice. Now, as we've said, we are looking at potentially making changes to the monograph, the information that goes with the vaccine, to say that there have been reports of this type of rare clot. So if people have any of the symptoms of clot, so in the case of the central ones, the ones that are involved the bands around the brain, if they have a sudden headache, if they have a headache that persists past 3 days, make sure that they go in and be seen. If they have any other symptoms of clot, so shortness of breath, pain or tenderness in their calves or legs or anything like that, then they should go and be seen. Overall, we are not making any changes to the recommendations at this point in time. The issue of looking at the specific type of clot is ongoing, as it is with clots in general. And just to say that the information that we've seen in terms of the more common types of clots in general has not shown any increased risk with people getting the AstraZeneca vaccine compared to people that are not getting the vaccine.
Thanks. And I don't know who can give us this, but perhaps you might be able to say. I'm looking for an update, I guess, overall on the other 3 vaccines that we have less clarity on in terms of delivery schedules and also the approval of Novavax. So where are you at on the approval of Novavax? And do you have any updates on when the supply of AstraZeneca that was contracted for delivery from the U.S. beyond the 1.5 that Biden's giving us, when that's coming and when the Johnson & Johnson vaccine is coming?
Sure. So maybe I can answer the Novavax review question first and then turn it over to others on the supply questions. So Novavax is under review, as we've said before. We are still expecting significant chunks of information from the company, both on the manufacturing side, but also on the clinical side. So the large phase 3 trial involving the Novavax vaccine is not expected to report out until next month at the earliest. And so we really would depend on getting both those packages of information before we were able to say how close we might be to making a final decision.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. La prochaine question. Next question, Lynn Desjardins, Radio-Canada International. Your line is open. À vous la parole.
Yes. Can you please tell me whether the AstraZeneca vaccine is effective in the 3 variants? There was some question at one point whether it was effective in use against the South African variant.
Right, so I can start with that question. So with respect to when we look at variants and how effective vaccines are against them, obviously the best information that we can get is if they're being used and we're getting real world information from how people are responding. For the AstraZeneca vaccine, we have seen both in laboratory tests and from real world evidence that it seems to be quite effective against the United Kingdom variant, the 117 variant. And as you mentioned, the South African variant, there was some lab data where you take blood from people who have been vaccinated with a vaccine and then test it against, see if it performs antibodies against that variant, where the AstraZeneca vaccine did not perform very well. However, that's not the only response from the vaccine. So in general, right now, the question is whether or not the AstraZeneca vaccine has good efficacy against the overall South African variant. But what we do know is that it is likely still quite good, even in the South African variant, for severe disease, so hospitalizations and potentially deaths from COVID-19. So I think we still need a little bit more information from the South African variants with respect to AstraZeneca, but again, in the places that it matters the most, again, severe disease, hospitalizations and deaths, it seems to be quite effective against the variants.
Likely still quite good. Thank you. In the South African variant for severe disease, so hospitalization and potentially deaths from COVID-19.
Prochaine question et s'il y en a qui peuvent fermer leur micro en arrière, on entend la conférence de presse à la télévision.
Unfortunately, we're hearing your sound. Somebody has their mic on.
Perry, CBC News, votre ligne est ouverte. Please go ahead.
Hello, thank you for taking my questions. Preliminary research from the United Kingdom has found that delaying the second shot of some vaccines for cancer patients leaves them partially unprotected. I'm just wondering if there's anything being done to update the guidance surrounding delaying second shots for up to 4 months for people in this situation.
This is Theresa. Maybe I'll take that question. As I understand it, the National Advisory Committee on Immunization will, of course, take on board any ongoing data that's available. So I would expect that this kind of data will be looked at. Again, some of the data that's been released in the media, you need to dig into it a bit in a bit more detail. But that's the type of information I expect will be examined.
Else want to comment on that?
Your follow-up?
Oh, sure. I'm just wondering if federal officials are going to be giving Canadians any more direction or advice on what they can do once they're vaccinated. I mean, can they go see their family? Can they attend gatherings? The Centers for Disease Control in the United States has put out some guidelines. I'm just wondering if we're going to see something like that in Canada.
So this is an area of active discussion with the provinces and territories. Obviously, we're in our early days in terms of vaccine coverage. And but some of the very initial areas where provinces are re-examining their public health approach will be for long-term care homes, and then looking at healthcare workers who've also been vaccinated in terms of whether they need to observe the same quarantine, for example, if they've been exposed. So that's a key update. But I think for now, the key message is that everyone needs to keep up with their personal protective measures, which is wearing a mask, hand washing, watching your distance, and avoid close, crowded conditions. I think as more and more people get vaccinated, I would expect the advice to evolve as we go along, but it's a little bit too early. And then there's the variants, of course, that's escalating as well as we speak with increased activity in communities. And I think community transmission and that sort of activity overall really is what drives the local decisions on what kind of restrictive public health measures need to be implemented.
Merci, thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you. Merci. The last question is from Catherine Aylesworth, Global National. Your line is open. À vous la parole.
Hi, thank you. My question is for Dr. Tam. There's a new report out today showing a troubling rise in incidents of anti-Asian racism in Canada. The pandemic has only made this worse. You've been at the crossroads of both. Can you speak to the toll that this is taking?
Yes, so I think the pandemic has had a significant toll on everyone. There is no doubt. But some populations have experienced more impact than others. And certainly in the last report I published, as the Chief Public Health Officer's annual report, I pointed to the inequities and for which racism, but also other social and economic factors result in certain populations being disproportionately impacted by COVID-19. And I think that one can understand the frustration and, that being a general sentiment, but there's never a excuse for racism in our society. So I think that is really important, and people need to support each other and be patient. And I have to say that in general, Canadians have been very supportive of each other, which is how we got through the pandemic to this point. And we just need that to continue for a bit longer as the vaccine is rolling out. So absolutely, we should not tolerate hate or racism against any groups in our community, but we just got to be compassionate and patient with each other.
Okay, thank you so much. No follow-up.
Merci. Ceci met donc fin à la conférence de presse d'aujourd'hui. This puts an end to today's press conference. Thank you, everyone.